afternoon. I'm going to call this oversight hearing to order. Today we're here to examine the Indian Self-Determination and Education Assistance Act. I call it ISDEAA. Does anybody else call it ISDEAA? There's been such debate about the correct pronunciation. So as a committee, I would like us to agree on just calling it ISDEAA? ISDEAA.
Defer to the chair.
ISDEAA. Indian Self-Determination and Education Assistance Act. If we use that every single time, this hearing is going to be twice as long, so it's ISDEAA. But we're also going to talk about its successes at the Department of the Interior and IHS. This year, on January 4th, we marked the 50th anniversary of ISDEAA being signed into law. Passed unanimously by Congress, ISDEAA transformed the relationship between the federal government and tribes by empowering them to take over the administration of federal programs and services that serve tribes, tribal members, and Native populations, and tailor them to their communities' unique needs. Historically, these programs and services were provided by federal agencies directly through the BIA at Interior and through the IHS at the Department of Health and Human Services. Over the past 5 decades, tribal nations have proven time and again that self-determination and self-governance work. And they work because no one understands the needs of Native communities better than the communities themselves. And when tribes are in charge of the programs that serve their people, outcomes improve, opportunities grow, and cultures thrive. Alaska is a perfect example of this. Take the Alaska Tribal Health Compact, which was established early in the self-governance era. It showcases what's possible through self-governance. Alaska is the only state in which over 99% of health programs are managed by tribes and tribal organizations, and it has led to world-class healthcare and public health services to over 170,000 Alaska Native people, from Anchorage to the most remote corners of our state. But it's not just in my state of Alaska. Many tribes across the country have built effective programs over generations using ISDEAA, investing their own resources, training their own workforce so that they better align with their culture and community needs. These are the models of local innovation and sovereignty, and they deserve both protection and sustained support. In order to continue and build on these successes, we need federal agencies to be good partners. Having the right people, departments, and processes in place to approve and enable ISDEAA agreements is essential. Now, I do have concerns about how the executive orders on optimizing the workforce across the federal government and reductions in force are affecting tribal programs. So I've reached out to both HHS, DOI, and other departments, urging each to exempt tribal programs and staff. My colleagues and I have heard regularly from Native communities about changes to service delivery and processes, empty staff positions, shortened deadlines, and ever-circling rumors of perhaps more changes to come. So right now, it's more important than ever for Congress, the administration, and tribes to work collaboratively and seek solutions that work for their communities. We know the benefits go beyond Native communities into every corner of the country. So I want to thank all of our witnesses for being here today. I know that the trip to DC is not always an easy one, but know that your time and your expertise are invaluable. The insights you share will help inform our continued work to strengthen federal programs and uphold the promises made to tribes and Native people. So I look forward to your testimony. I now turn to the Vice Chair for his opening statement.
Thank you, Chairman Murkowski. In 1970, President Nixon signaled a shift in U.S. policy away from an era of termination and toward self-determination for tribal nations. Congress responded with a bipartisan promise. Let tribes run federal programs that serve their own people and fund them fairly. That promise became what we all know as ISDEAA. It's not a pilot program, it is not DEI, it is not optional. It is part of our federal responsibility to meet our trust and treaty obligations on a government-to-government basis. Over time and across agencies, ISDEAA has scaled up. At DOI and IHS, there are thousands of tribal self-determination contracts and self-governance compacts in place. Tribes are operating clinics, police forces, schools and service centers close to home, and doing it cheaper and better than the federal government could. The takeaway is simple. When tribes lead, outcomes improve. That success deserves protection, not second guessing. But today we are seeing an erosion of our responsibility, and I am concerned. This administration is downsizing the federal government and adding more layers of bureaucratic review that is stalling self-determination, slow-rolling 638 funds needed to deliver life-saving health care, public safety, and basic tribal government services does not honor tribal sovereignty. It undermines it. Congress made clear that ISDEAA tribes decide how to run federal programs and how to best serve their citizens. When the administration micromanages approved funds, second-guesses tribal decisions, and requires loyalty to the president's policies to get money they are owed, that is not sovereignty. That's paternalism. I'm also concerned that cuts to the federal workforce are hollowing out the staff needed to negotiate these 638 agreements, answer phones even, and move the money. Tribes can't put 638 funding to work if there's no one around to sign off. Staffing gaps mean service gaps, and people suffer. Self-determination is about exercising tribal sovereignty, full stop. Delays, freezes, cancellations, and new conditions take tribal choices and conditions and control away. We've already seen a clinic and hospital services rolled back and tribal employees told there are no funds for their next paycheck. And that is not efficiency. That's going back on a promise Congress made 50 years ago when we passed this law. We should celebrate ISDEA's anniversary by getting back to the basics, pushing dollars out the door, trusting tribal decision-making, and not making tribes run obstacle courses to access funds. They are not a grant recipient, and the federal government is not the Ford Foundation. We have a special legal and moral obligation under trust and treaty obligations. And that's how we can ensure self-determination endures for the next 50 years and beyond. Madam Chair, I'd like to enter into the record a report prepared by the Brookings Institution that details what's at stake for tribes when the federal government stops funding, including 638.
Without objection.
Thank you to our witnesses, and I look forward to your testimony.
Thank you, Senator Schatz. We have with us today Mr. Kenneth Belmard. He is the Deputy Assistant Secretary for Policy and Economic Development at the U.S. Department of Interior here in Washington, D.C. Welcome to the committee. We have Mr. Ben Smith. He is the Acting Director for the Indian Health Service at the Department of Health and Human Services, also here in Washington. Senator Mullen, would you care to introduce our chief from the Cherokee Nation?
Absolutely. I was going to wait till he was speaking, but I always take an opportunity to speak to my friend or speak about my friend.
There you go.
Chief, welcome. I just want to want you to understand the servant that Chief Hoskins has become and has been for Cherokee Nation, an advocate and a voice that didn't just start with him decided to run for chief, but a long history of serving. He's been a dedicated servant, having served as Cherokee Nation Secretary of State, as well as a member of the Deputy Speaker of the Council for Cherokee Nation prior to being elected Principal Chief in 2019. He's a leading voice in Indian country on several fundamental areas, including the rural health care, economic development, and tribal self-governance. And I want to speak just a second about the Indian health care. The hospital that Cherokee Nation is blessed to run is Hastings Hospital, which is where I received all my dental care, vision, 100 emergency care visits when I was a kid, to the point where they had to get me, when I was a kid, before they had medical records electronically, you had folders, and every time you'd go into, and Chief, you may remember this, every time you went into to Hastings, you had to get your folder, and I had two. Before I was in 7th grade, and it was the only health care I ever received. It was the health care. To see where it's at today, what Cherokee Nation has developed it into, that Hastings Hospital now is partnered with OSU Medical, and they're training rural doctors out of that hospital now. And it's because of the private-public partnership between the state, between the federal government, and between Hastings, which is Cherokee Nation. The vision that they had, if we're going to have doctors in rural healthcare, we have to train them in the rural America. And so instead of just abandoning the hospital that I grew up going to, it's a medical hospital now. And that's the type of partnership that we need in and visions that we need inside Indian country. We need the ability and the flexibility to be a sovereign nation, to see the need and fit the need to those in our own community. And that's what this is all about. And Cherokee Nation is something that I'd love to brag about because it is an example of providing that care. And Chief, it's wonderful to have you here in Washington, D.C. And, you know, I'll see you in Oklahoma soon, I'm sure.
Thank you, Senator Mullen, and welcome to you, Chief Hoskin. Next to Chief Hoskin, we have a friend to the committee, Mr. Victor Joseph. He has been before this committee previously in his former role as Tanana Chiefs Conference. He is now the executive director at the Tanana Tribal Council from Tanana, Alaska, but has long been a leader on so many of the matters related to providing for health care, but other areas of leadership throughout the state. So welcome to the committee. And our final witness today is Mr. Jay Spann. He is the Executive Director for Self-Governance, Communication, and Education Travel Consortium, also from Oklahoma, out of Tulsa. So welcome to you, Mr. Spann. I want to remind our witnesses, we do have your full written testimony. It's going to be part of the official record. So we would ask that you try to keep your oral comments to less than 5 minutes so that we have plenty of time for conversation and questions. So, Mr. Belmart, you may begin with your testimony, please.
Chairman Murkowski, Vice Chairman Schatz, and members of the committee, thank you for the opportunity to testify today on behalf of the Department of Interior regarding the Indian Self-Determination and Education Act, ISDEAA. My name is Kenneth Belmard. I am the Deputy Assistant Secretary for Policy and Economic Development for Indian Affairs at the Department of the Interior. Aho, Zaziwitachi, Chimokman, Haya Bahe, Watonga Angota, Unga Chiba, Midasha, Wahuina. I am an enrolled member of the Kaw Nation hailing from Ponca City, Oklahoma. I'm glad to be here today as we look at the successes and opportunities of ISDEAA 50 years after its passage. More than 5 decades ago, President Nixon appeared before Congress and repudiated the policy of termination and assimilation, declaring that we must make clear that Indians can become independent of federal control without being cut off from federal concern and federal support. This vision, self-determination without termination, set the stage for a new federal policy. Congress's unanimous passage of ISDEAA built upon this vision by creating a framework for tribes to assume responsibility for programs, functions, services, and activities that have historically been administered by federal agencies, principally the Bureau of Indian Affairs and the Indian Health Service. Over the years, Congress has refined ISDEAA to strengthen tribal self-governance, including through the passage of the Progress for Tribes Act signed into law by President Trump in 2020. These reforms reflect a consistent trajectory, expanding tribal authority, reducing bureaucratic obstacles, and improving clarity in federal tribal contracting and compacting. We thank the committee for its engagement and leadership on this important topic. Today, ISDEAA remains a cornerstone of tribal self-determination, enabling tribal nations to tailor programs to their unique needs, make more efficient use of funds, build tribal management capacity, and improve community outcomes. The success of ISDEAA is evident, demonstrating that local control and knowledge lead to more effective programs, enhance administrative capacity, improve governance and leadership, and significant economic benefits. The department is committed to helping fulfill the promise first made by President Nixon 55 years ago and looks forward to the next 50 years of self-governance by tribes. Thank you again for the opportunity to testify today. I look forward to our continued work together to strengthen tribal self-governance, and I would be pleased to answer any questions you may have. Weeblaha.
Thank you, Mr. Belmard. Mr. Smith, welcome.
Good afternoon, Chairman Murkowski, Vice Chairman Schatz, and members of the committee. My name is Ben Smith. I'm currently serving as the Acting Director of the Indian Health Service. I'm also a citizen and member of the Navajo Nation. It's such an opportunity to be able to provide testimony on today's topic, the ISDEAA, and specifically the success and opportunities at the Indian Health Service. Our agency, the Indian Health Service, within the Department of Health and Human Services, has a unique mission to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. This mission is carried out in partnership with tribal governments, tribal communities, through a network of over 600 federal and tribal health facilities and 41 urban Indian organizations that are located in 37 states that provide health care services to approximately 2.8 million American Indians and Alaska Native people annually. The Indian Health Service today is the 18th largest healthcare system in the United States, and we consist of 12 area offices that oversee 170 service units that provide care at the local level. Health services are provided through these facilities, and they're managed by the Indian Health Service. They're managed by tribes and tribal organizations, and through contracts and grants that are awarded to urban Indian organizations authorized by the Indian Healthcare Improvement Act. 50 years ago, the Indian Self-Determination and Education Assistance Act marked a monumental turning point in federal Indian policy, empowering tribal nations to reclaim authority over essential services and decision-making that directly affect their peoples. At the Indian Health Service, under the ISDEAA, both Title I and Title V of that act authorize the Secretary of the Department of Health and Human Services to contract or compact with tribes or tribal organizations upon their request. A key difference between the two titles, self-determination contracts and self-governance compacts, is the amount of tribal flexibility. For example, under Title I, IHS must approve any substantial changes to a contract, where under Title V, the self-governance program, a tribe may rebudget or reallocate or consolidate programs, functions, services, or activities, or what we call PSFAs, without Indian Health Services approval, as long as the redesign does not have the effect of denying eligibility. Because participation in ISDEAA agreements is voluntary, tribes have options to determine how they receive IHS authorized services. For example, a tribe could choose to continue to receive services directly from the Indian Health Service as a federal provider, or they may exercise the authorities of the ISDEAA by entering into a Title I self-determination contract or a Title V self-governance compact to assume operations of those PSFAs with the associated funds that IHS would otherwise provide. There's a third option. There's a combination of all of them, and we see that play out through the country. In fiscal year 24 alone, you're speaking to the volume of these agreements. The IHS has 247 self-determination contracts and annual funding agreements with 232 federally recognized tribes. Coupled with the Tribal Self-Governance Program, where we have 114 compacts and 141 funding agreements, this represents approximately $3 billion of the Indian Health Service total appropriation that's transferred to tribes and tribal organizations to manage their health programs through these contracts and compacts. As we think about 50 years ago, when the majority of healthcare programs were provided by federal agencies to now, where in the Indian Health Service alone, approximately 62% of the IHS budget is now managed by tribes through ISDEAA contracts and compacts. We are seeing these changes. Self-governance arrangements have not only expanded service access, but also improved patient satisfaction and tribal oversight. Tribes and tribal organizations are developing their own strategic health plans, improving health clinic efficiency, and maximizing third-party revenue through Medicaid, Medicare, and private insurance billing. We see a number of successes throughout the country. A tribe in Washington State, for example, developed a state-of-the-art family health clinic integrating primary care, dental, behavioral health, and an opioid treatment program. A tribe in Oregon established a wellness center offering integrated, culturally grounded medical, dental, and behavioral health services. We see tribes, tribal organizations in Alaska, Arizona, and Oklahoma operating some of the largest and most comprehensive tribal health systems in the U.S., these encompassing hospitals and a wide range of facilities. We thank you for your commitment and dedication to improving health care for American Indians and Alaska Natives, and I'm happy to answer any questions the committee may have.
Thank you, Mr. Smith. Chief Hoskin, welcome.
Chairman Murkowski, Vice Chairman Schatz, and members of the committee, it's an honor to be here. I appreciate the opportunity to testify. Senator Mullen, thank you for the kind introduction. Your tribal nation and myself are proud of you and your service to the country. It's my honor to serve as Principal Chief of the Cherokee Nation, the largest tribal nation in the United States. We have a 7,000 square mile reservation in northeast Oklahoma, over which we exercise exclusive tribal jurisdiction rooted in treaties between our tribal nation and the United States. I represent over 470,000 citizens. That includes citizens that reside within our reservation and in every state of this country. We are the economic engine of northeast Oklahoma. We employ over 15,000 employees, and I think just as important, we support or create about 23,000 jobs in the private sector. Our annual economic impact exceeds $3.1 billion, and of course this impact extends to our friends and neighbors. Back home, we are more often than not the problem solvers, the entity, the government that people look to fix things, to make life better. 50 years ago, that was not the case. But 50 years ago, President Nixon and the Congress, a bipartisan coalition, enacted ISDEAA. It's no coincidence that 50 years later, the Cherokee Nation has never been stronger and our future is bright. We can spend a dollar better, wiser, and more efficiently than the federal government can. We prove it every day, and we've compacted with the government of the United States for every available program. We shape the programs, we develop strategies, and we execute those strategies, from infrastructure to housing to healthcare to education to managing our lands and other natural resources to handling our own realty services so we can efficiently handle trust and restricted land title matters. We are in control. We cut through red tape. We get things done, all thanks to ISDEAA. Most recently, we did it with the U.S. Department of Transportation. We are the first tribe to achieve a self-governance agreement with that agency. It took 10 years of effort, but we now have the flexibility to better plan one of government's basic function, and that's the provision and maintenance of transportation infrastructure. This is very important in rural areas where improvements to transportation means access to jobs, healthcare, the streams of commerce, and where if we fail on transportation, communities may fail. Nowhere is there a better example of the power and promise of ISDEAA than healthcare. 50 years ago, I was born in the Claremore Indian Hospital, an IHS facility. In 2 weeks, the Cherokee Nation will assume operations at Claremore. It will become our 12th healthcare facility, and it will sunset the last IHS facility within the Cherokee Nation reservation. We'll immediately invest $11 million into the facility to bring it up to our standards, and in 2 years, we will replace it with a brand new outpatient and emergency healthcare facility with a wellness center. We're building towards a world-class system of wellness, mostly in rural areas, because we're in control of our healthcare destiny. We decide the priorities, we shape programs, we design these amazing healthcare facilities. We partner with great institutions like Oklahoma State University on a medical school, the first in Indian country, and the University of Oklahoma on world-class cancer care and research. Rural healthcare in this country is struggling. Cherokee Nation healthcare in the heart of rural America with over 2 million patient visits a year, and that includes members of every federally recognized tribe that wants to use our services. We're thriving in rural America. Last year, we even came to the rescue of the United States. The VA was shutting down a clinic in my hometown of Veneta. The last administration shut it down when the lease was lost. We stepped in, we took action. We said, come to the Veneta Cherokee Nation Health Center. We have room for you. We saved health care for all veterans in that rural community, in our state-of-the-art facility. In the decades since the passage of ISDEAA, we have demonstrated conclusively that when tribes control their own destiny, we thrive. We're better off today than we have been in generations, socially, politically, economically, because of self-governance. It's the difference maker. We strongly support the expansion of these authorities, and we stand ready to avail ourselves of any expansion in the area of self-governance. I appreciate the opportunity to testify and certainly answer any questions.
Thank you, Chief, for walking us through the successes there at Cherokee Nation. Appreciate it. Mr. Joseph, welcome to the committee.
Thank you, Chairman Murkowski, Vice Chairman Schultz, and members of the committee. I want to bust for the opportunity to provide testimony in recognition of the 50th anniversary of the Indian Self-Determination and Education Assistance Act, ISDEAA. My name is Victor Joseph. I serve as the Executive Director for the Tanana Tribal Council. I also serve as the Chair of the HHS Secretary Tribal Advisory Committee and the Co-Chair of the IHS National Tribal Budget Formulation Work Group. Tanana Tribal Council is part of the Alaska Tribal Health System, a voluntary affiliation of 229 federally recognized tribes and tribal organizations providing health care in Alaska. With innovation and collaboration, the Alaska Tribal Health System is a testament to the inherent strength and advantages of tribal self-governance and tribal self-determination. There are still challenges. Many of our rural communities lack road access to their regional hospitals, and unpredictable weather can make airline travel unreliable. These challenges led to two significant innovations within the tribal health system. First, telehealth services. Decades before the widespread adoption seen today, the technology supports frontline healthcare workers that make up the backbone of our system. Second, community health aid program. Community health aides, behavioral health aides, and dental health aides, therapists, who all originated in Alaska, are now national models. These providers deliver critical services in their communities and, for the most part, come from their communities and supported by their tribal leadership. However, despite the remarkable success of ISDEAA, opportunities for further improvement remain. The Alaska infants from communities without running water are 5 times more likely to be hospitalized for respiratory infection, 11 times more likely to be hospitalized for pneumonia compared to the general population. In unserved communities, 1 in 3 infants will be hospitalized every year due to the lack of running water. As new sanitation systems get installed, our existing infrastructure ages, adequate operations and maintenance funding is necessary to protect the federal investment and health of our people. IHS has the authority to fund operation and maintenance of these systems. I respectfully request this committee directs IHS to work with tribes to identify the current and projected operation and maintenance needs to inform the future agency's budget request. Additionally, the Purchase and Referred Care PRC program is a significant component of the IHS and tribal health delivery model. Recognizing not all services are available within the system and that transportation to care, whether within the tribal health or to a non-tribal health provider, is necessary for healthcare access. In Alaska, PRC spending on transportation services, which is necessary to access higher level of care in much of Alaska, has increased dramatically due to the significant escalation in travel costs, threatening our ability to maintain access to care for those living in rural communities. IHS federally operated programs have maintained significant, unobligated, or unused PRC financial balances. This may effectively mask the underlying PRC needs. On behalf of the patients we serve, we respectfully ask Congress to increase the PRC budget to address the increased cost of transportation. The PRC program has not received a meaningful program increase in over a decade and has been flat funded in the past 6 fiscal years. IHS remains a key federal partner. It is critical that IHS receives adequate funding to hire and retain their staff, from timely technical and legal assistance to engineering and environmental health support, when IHS is not provided the resources needed to maintain its personnel. All tribes, direct services and/or compacting, pay the price. As this committee rightfully focuses on the success and potential opportunities associated with ISDEAA, The Alaska Tribal Health System serves as a powerful example of what is possible under self-governance, and we fully support the expansion of tribal self-governance. Thank you for this opportunity to provide my testimony today. Basi.
Thank you, Mr. Joseph. Appreciate all you do and for making the long trek. We next turn to Mr. Jay Spann.
Chairman Murkowski, Vice Chairman Schatz, and members of the committee, thank you for the opportunity to testify today. My name is Jay Spann. I'm a citizen of the Cherokee Nation and serve as the Executive Director of the Tribal Self-Governance Consortium. This year marks the 50th anniversary of ISDEAA, a law that fundamentally reshaped the federal-tribal relationship. Before ISDEAA, federal agencies administered nearly every program in Indian country with little input from tribes. ISDEAA affirmed that tribes have the inherent right to govern our own affairs and gave us the tools to assume administration of federal programs through self-determination contracts and self-governance compacts. Today, nearly all tribes operate programs under ISDEAA, and more than 400 tribes use self-governance authority to deliver a wide range of services. The last 50 years have proven that ISDEAA is a success. Programs are delivered more effectively, communities are strengthened, and federal dollars are used more efficiently. This administration has signaled that self-governance aligns with its priorities of reducing bureaucracy, strengthening local control, and improving efficiency. We are encouraged by Indian Affairs' actions to reassess inherently federal functions and efforts to modernize outdated regulations. Welfare assistance rules, for example, predate self-governance and impede tribes from tailoring programs without unnecessary approvals. At IHS, the growth of self-governance is driving structural reform, and Secretary Kennedy has reaffirmed HHS's commitment to shifting authority and resources closer to tribal communities. However, we see troubling misalignment between positive statements and agency actions. For instance, BIA's new 105L lease guidance imposes appraisal standards that many tribes believe will be impossible to meet in rural tribal communities, resulting in undervalued facilities, a potential violation of ISDEAA's fair compensation requirement. In addition, DOI now requires tribes to justify every drawdown of ISDEAA funds in its ASAP system, a burden that conflicts with the law and was never agreed upon in binding agreements. Additionally, tribes are being asked to attest they don't use some grant funds that are critical to supplement underfunded self-governance programs for DEI activities before releasing the funds. Adding new administrative burdens and micromanaging how tribes spend federal funds are contrary to the key tenets of self-governance. Similarly, IHS revised personnel agreements in ways that are discouraging use of longstanding IPA arrangements that help retain qualified staff. These unilateral changes undermine self-governance. We are also disappointed that critical funding and key personnel needed to ensure success are not being protected. Tribal leaders, GAO, and the U.S. Commission on Civil Rights have all warned that inadequate resources limit the ability of tribes to assume programs under ISDEAA. Yet the fiscal year 26 budget proposes significant cuts to BIA programs that tribes already operate or are poised to assume. Attempts to expand pathways to self-governance while slashing resources is self-defeating. We recognize the goal of reducing bureaucracy, but downsizing at agencies without regard for their roles in self-governance has stalled negotiations, created inefficiencies, and limited expansion of self-governance. Workforce reductions at HHS left some tribes without a contact to negotiate indirect cost rates, threatening timely transfer of vital funds. Delays and lack of responsiveness remain serious challenges at both BIA and IHS. Many tribes wait weeks or months for basic responses. The IHS Tribal Self-Governance Advisory Committee has also cautioned that the proposal to centralize negotiations at headquarters may slow negotiations, trigger more final offers, and weaken long-standing tribal area relationships. Equally troubling are reports of federal employees discouraging tribal leaders from pursuing self-governance through direct interference or misuse of inherently federal function determinations. 50 years after ISDEAA became law, this is unacceptable. Timely responsiveness and respect for tribal authority is non-negotiable. Despite these challenges, self-governance remains successful and now spans transportation, food distribution, and forest management across multiple agencies. In conclusion, self-governance fulfills trust and treaty responsibilities, advances efficiency and accountability, and strengthens tribal sovereignty, but it cannot succeed if funding is cut, critical staff are reduced, or new barriers and misinformation undermine tribal authority. We offer the following recommendations. 1, ensure full, stable funding for programs eligible for self-governance. 2, make CSC and 105L payments mandatory appropriations. 3, align workforce decisions to strengthen, not weaken, the federal-tribal self-governance partnership. 4, require robust tribal consultation before policy or structural changes. And lastly, expand self-governance to additional HHS and USDA programs. This will help significantly to reduce unnecessary grant burdens. This concludes my statement, and I am pleased to answer any questions.
Well, thank you to all of our witnesses. It's clear from those of you who have participated today that 50 years later, we're in agreement that ISDEAA is not only good, it's important, and it has led to a level of empowerment and self-determination that we see not just in words, but in practice on the ground, making a difference, whether you're in Oklahoma or you're in Alaska and other parts around the country. I want to ask you, first off, Mr. Belmard, Mr. Spann has just kind of outlined some recommendations here in terms of ways to move forward to ensure that the vision of ISDEAA really does move forward. And we recognize that so much of what happens on the ground requires that a level of processing, if you will. You've got to have folks that are in the department, so you have to have adequate staffing, you have to have adequate funding. Both DOI and HHS have undergone and are undergoing workforce reorganizations. We've seen retirements and resignations of staff, probably with some pretty institutional knowledge that are no longer in place. And I've been hearing tribal leaders express some frustration that Interior is not timely in its response for requests for information or in self-governance negotiations. So can you share with the committee how many FTEs your agency staff has been reduced since the beginning of this administration? Do you have those numbers?
I don't have those exact numbers, but, and thank you for the question, Senator. What we have done in our hallway with self-governance is we've moved our offices directly into our hallway across from where I'm at, so I can monitor our self-governance activities. We are always undergoing attempts to train our staff sufficiently. We send people out on negotiations every time we have a request. And as far as any kind of effective diminution in any activities, we have not seen that as far as what we've been told. Our staff has a sense of urgency, and we ask them to comport with the ideas embodied in ISDEAA.
Well, let me then ask perhaps you, Chief Hoskin. You have cited to many of the successes. Are you having challenges with regards to any self-governance negotiations, any delays coming out of the Department of Interior or within IHS specifically that we might want to share? This is an oversight hearing, so I appreciate that you're trying to make do with less oftentimes, but it'd be helpful if we had some examples of perhaps areas that we need to work on.
Well, thank you, Chairman. Our concerns right now are anticipatory based on sort of the unknown and the seeming instability that has occasioned these rifts. Self-governance is not about the wholesale transfer of governmental functions. It's about the meaningful transfer, and the meaningful transfer has to include technical assistance. And so if we're seeking technical assistance and we know there's been a rift, we do have concerns that in the future, as we need to lean in and ask for assistance, that the assistance will be slower to come. We know that the additional administrative burdens, and Jay Spahn spoke to those, means that there may be more occasions to reach out and say, are we compliant with these new anti-DEI standards, for example? We need to know that. More burdens and less staff logically means inefficiency from our standpoint. So that is sort of an anticipatory concern as we get further into this administration.
Okay. Let me ask you another question, Mr. Belmard, as to whether or not you are taking steps to change your payment mechanism so that funds transfer directly to tribes like they do in IHS. Is that something that you're working on within the department?
Yes, thank you for the question. In fact, there were some issues earlier this year with through the Treasury Department and the payment requirements. There was a requirement for justifications on each of those payments. As soon as we got that information, we began negotiating with Treasury, and we have an agreement in principle with Treasury that, of course, being the government, we have to work through that requirement for justifications will, once there is an actual list of all the recipients of self-governance funds, justifications will no longer be required for those payments to be executed.
So it will be similar to what we see at IHS.
Yes.
Thank you. Senator Schatz.
Thank you. Thanks to all the testifiers. Mr. Spahn, I want to start with you. My understanding is that nearly $25 billion are potentially held up, but specifically $2.8 billion in IHS and over $4 billion in BIE and BIA funding. You testified the tribes are now required to justify their 638 drawdowns. Can you give us a sense for what kind of additional information is being requested and sort of the frustrations that you're hearing from tribes?
Yes, thank you, Vice Chairman Schatz. As far as self-governance funding goes, what we're seeing is that the ASAP system, which is the system that tribes use through Treasury, the ASAP system was developed as a reimbursement-based system for grants, and DOI chose to use that for the transfer of funds, so we've always believed that's a mismatch to start off with self-governance. IHS and Department of Transportation do direct transfers, which is a much more effective mechanism. Because DOI was using the ASAP, whenever the executive order came out requiring additional justifications, Treasury added a justification field. So every time there's a drawdown, a tribe has to submit information into that section of the ASAP system before they can draw it down. By submitting that, tribes are very concerned that someone's going to be reviewing it and say that their submission wasn't sufficient and hold up funds, or there's going to be delays. ISDEAA is very clear that the agencies do not have the authority to impose additional rules or justification requirements on the transfer of funds, and that the transfer of funds must be timely and without delays in any way.
Do you think they're violating federal law right now?
It does not seem to be compliant with ISDEAA.
Thank you. Mr. Smith, tell me more about this new so-called presidential appointee approver and departmental efficiency review process. I'm told that it requires multiple layers of approval on all contracts and requisitions, including 638, and it's making tight budgets and staffing shortages at IHS even worse. Is that your assessment of what's happening?
Thank you, Vice Chairman. As to clarify, 638, our process is moving unchanged. Payments are being made in accordance with the ISDEAA. But you are correct. For acquisitions and contracts, we are implementing the executive order, which does bring in an additional level of review, utilizing a presidential appointee approver and the departmental efficiency review process. What I can share with you is that we have seen minimal to no impact of this process at Indian Health Service.
Mr. Spahn, is that your sense of what's happening? I just want to sort of, I'm not trying to be too adversarial here, but you're saying no delays. Mr. Spahn, is that true from the perspective of the tribes that are 638 tribes?
What we've seen on the most part is the delays are in whenever grants funds are being drawn down, is that there are additional justification requirements associated with the grants. And so a lot of tribes will go to get their money and they get an email asking for justification. Some of them put in a justification, they receive another email saying this wasn't sufficient. Tribes are also getting emails saying, please attest that you're not using this for DEI activities.
Mr. Smith, is this working?
Well, as you may know, Indian Health Service is not a large grant-making agency. We do have a few. I will.
Right. I just want to understand, just at a more basic level, do you think this is working, or do you think we have some kinks to work out together? Do you think this is functioning well?
I agree, improvements can always come together.
Okay, I'll take it.
Partnership.
I'll take it. Did HHS engage in any formal tribal consultation before implementing these changes?
But as I mentioned, these were executive orders. They applied to all federal executive agencies. So as part of implementation, the order is the notification.
The notification.
Correct.
So there was an executive order, and of course, tribes and everyone else, because these things get published on the internet, got notified. That's not what I'm asking, as you know. I'm asking about tribal consultation, and you're more deeply ensconced in this world even than I am. So was there any tribal consultation?
Thank you. I see your question now. No, there was no formal initiation of tribal consultation.
Okay, is that something we may want to consider?
We can certainly take that back and review.
Okay.
But again, I would say that executive order is only applied to the executive agencies.
Just finally, the chair and I sent a letter now months ago, and we have not received a response from the secretary. When do you think is a reasonable time frame to respond to our letter?
I will certainly follow up. As we mentioned, communications are key. We all want to be timely. I will certainly take this back today and see if we can't find out a timeline.
I'm just a little concerned. I have talked to the secretary directly about his commitment to Native people. He told me he initiated the phone call and said that he wanted to follow in his his uncle's legacy of taking care of Native people. And so I wonder whether he even got this letter. And I wonder whether he is even tracking what is being done in his department to Native people. And I would just like to flag that for you. We wrote a letter on a bipartisan basis. It was not adversarial. We're doing what we always do. But not responding to us puts us in a different posture. And I would really like to make sure that the secretary is aware that all of this is happening, and that on a bipartisan basis we have some alarm, and that we'd like to resolve it as soon as possible. Thank you.
I believe it's Senator Smith.
Great. Thank you so much, Chair Murkowski and Vice Chair Schatz. I want to just follow up on this line of questioning that Senator Schatz was getting on. I think I will turn to you, Mr. Spahn. The whole point of ISDEAA was to promote sovereignty and to change the relationship between the federal government and sovereign tribal nations to kind of end the paternalism that characterized the federal government's relationship with tribes. And so it seems to me that tribal consultation is sort of a foundation of this relationship, and for changes to be made to ISDEAA without tribal consultation, it seems like it kind of goes at the foundation of this. So could you just, and I've asked other folks in the administration at other times around this, and I want to be clear, I don't think that this is, both Democratic and Republican administrations need to be better at this. So I'm not making a partisan point here, but could you just talk a bit more about what that tribal consultation means and why it is important, and where you are seeing some breakdowns in the system that would, if we improve that, would save us a lot of time and money?
Thank you, Senator Smith. We definitely believe that tribal consultation is essential for making this relationship work, particularly under a self-governance partnership. Tribes are implementing and administering these programs, and so every decision that the federal agency makes impacts the tribe and how they operate. We saw the example recently with changes to the Section 105L guide, in which there was some changes that DOI has said they do not believe are substantial. Tribes disagree significantly. It's changed the way that appraisals are being done. It's requiring 3 comparables, which for rural and especially Alaska Native villages is impossible to get.
Right.
There's been discussions with appraisers that have been doing these Section 105L agreements for years, and they have all said this is a complete change of how we operate. So these types of changes are a big problem. There was changes with how interpersonnel agreements were made at IHS. This has caused tribes to steer away from using these agreements. These are very critical pieces and tools that Congress gave tribes to make sure the success of self-governance. So making these types of changes without input and understanding how it affects tribes is very concerning. And we do urge the agencies to do consultation before making any of these changes.
And even if you were to, remove from the equation, in all fairness, the question of motive, you could, why would you make these changes without doing the proper consultation? You could certainly conclude that it increases kind of the waste in the system, right? The time that's wasted, the money that's wasted. This is the beauty of appropriate consultation, is that it protects everybody from that huge downside, right?
Yes, that's correct.
Yeah. Chief Hoskins, I really appreciated your testimony and your elucidation of the power of self-governance agreements to really unleash the creativity and the entrepreneurship and the power, the economic power, and all of the power of Native people. And I'm just thinking about particularly the 638 authorities and what a difference that means. If you didn't have that, like what would you not have been able to do? What impact would that have had if that authority was not there for your people?
Well, thank you, Senator. I think just comparing this Indian Health Service facility in Claremore, again, to repeat, I was born there. Actually, I was born in the old one. So the new one came after I was born, and it's now old and it needs to be replaced. But you can imagine a world, we don't have to imagine it, we can see a world in which we go into, and this is my friend, Mr. Smith. I won't ask him this question, but he would admit that Cherokee Nation runs circles around the Indian Health Service just because of our system. You go across all of our facilities, they're state-of-the-art, they're world-class. We're driven to put the patient at the center, build out from there, put every penny of third-party revenue, which we're generating on a much higher rate than the Indian Health Service has ever done, and putting it right back into not only conventional health care, but wellness centers, other ways to look at healthcare holistically. We can plan that. We can lean into diabetes care. We can eradicate hepatitis C by working with a pharmaceutical company. We can make sure we give our people a place to learn and do better and learn better about nutrition because we decided it. That does not happen in a world without 638 contracts.
And you are always, in my book, you are always going to know what works best and how to do it best because you're closest to the issues, you're closest to the people. And so, it seems to me just self-evident. And I know I'm out of time, Madam Chair, but I want to just make a point here, and maybe this could be a follow-up with Mr. Belmard that we could follow up on, later, but it's become so clear to me that there are many federal agencies and folks in federal agencies that don't fully understand the power of 638 authority. I've worked for quite a long time with the Department of Agriculture to try to break through this. You've been so helpful to me, Mr. Spahn, as we've been trying to figure out in a bipartisan way how to get self-governance authority for full authority for the FDIPR program and for tribal food sovereignty. And clearly there's a lot of folks in the federal government who just don't know what to do. And I think this is a big opportunity, Mr. Belmard, for the folks in your area who do know, maybe if they're still there, who do know what to do. And so I'd like to follow up with you on this and how we can get a commitment to work more closely together so that we can break down some of these barriers on the agency side that Mr. Spahn has highlighted.
Thank you, Senator Smith. I appreciate what you have said about that because in my experience, there are clearly departments that get 638 contracting and how it works and the benefits. And then there are others where there is almost a cultural resistance. And we got to figure out how we break that down. Senator Cortez Masto.
Thank you. Thank you. And I couldn't agree more. But here's my challenge. We don't want to add barriers. We don't want to add more burdens than already exist. We want to make it more efficient. And what I'm hearing today, maybe I'm wrong, but what I'm hearing today at least is when it comes to drawing down grant funding, there's additional justifications required and those additional justifications are because of executive orders that have been issued. Is that correct, Mr. Belmard and Mr. Smith?
Thank you for that question. There was an executive order that placed that justification for those funds. However, as I mentioned earlier, in our working with the Treasury Department, we believe we have found a solution to that would allow, once the recipient list goes to Treasury of all the self-governance funds, then there won't be a requirement for justifications.
All right. Is that in writing?
We are undergoing that. We're working on the procedure that will allow for that to happen.
Great. When it's in writing, could you share that with us?
Certainly.
Thank you. What about you, Mr. Smith? Is there an executive order that's dictating what you can or can't do when it comes to the grant funding?
We do have the executive order, but what I can share is that at the Department of Health and Human Services, we were very targeted in helping to educate new leadership on the authorities of the Indian Self-Determination Education Assistance Act. As we know, there are very unique laws that come into place. When you hear contract or compact, anybody who's not familiar with Indian health immediately run to the federal acquisition regulations.
Yeah.
These are not governed by the federal acquisition regulations. They're not governed by the grants.
So, and I only have so much time, and I appreciate that. I understand the challenges you're facing. Has the education helped?
Absolutely.
And so are we going to see changes so that they are complying with the law?
As I mentioned, we are not experienced what I'm hearing
Okay.
our DIY colleagues are experiencing, but we will certainly coordinate and make sure we're all on the same page.
Okay. And then I think from both of you, I am curious to follow up on the FTEs. Where you stand now with the employees that you have? What's the hiring freeze? How many did we lose? How many positions are vacant? Is that impeding also the ability to do your job? And what we have heard here is that causing some of the delay as well?
Thank you so much for the question. Certainly, Indian Health Service has been carrying a 30% vacancy rate across the board. I'll put this in perspective. In January, we had 15,218 employees. We always hover around that 15,000 mark. Just this month, we're down to 14,613. Within that change, there's been no change to the FTE. There's been no reductions in force at Indian Health Service, aside from those that are triggered by the ISDEAA itself. We know that if a tribe assumes an operation, there is going to be a natural reduction in force in that area. But as an agency, no. But we have been able to work under HHS leadership in the Office of Personal Management on some limited exemptions. These are hard for us to keep up with right now, but we are working to identify the most critical needs.
Thank you. And let me just follow up on the ranking member's question in relation to Secretary Kennedy. Has Secretary Kennedy consulted IHS regarding actions affecting tribal health care delivery and staffing shortages?
Yes, he has immediately stepped in. In fact, when he first met with his Secretary's Tribal Advisory Committee, which he has now met several times, he has communicated the steps that he has done in prioritizing Indian Health Service.
Does that include addressing the staffing shortages and staffing?
Putting people on alert. So we are working with HHS leadership and the Office of Personal Management on limited exemptions to bring in critical employees.
I've got one specific question to Nevada, and I only got a short amount of time. Is the Nevada urban Indians have provided essential services to Nevada's Native community for years. Recently, HHS notified them that their grant under the Family Violence Prevention and Services Culturally Specific Domestic Violence and Sexual Violence Services Program was terminated. It was awarded to them by ACF, the Administration for Children and Families, and it has since been terminated. This has resulted in the Nevada urban Indians having to lay off 2 of their employees and has impeded their ability to offer trauma-informed, culturally rooted services to women and children who are victims of domestic violence. I'm going to ask you to, I can't imagine you can answer that right as we sit here today, but I'm going to ask you if you would respond to me as why that grant was terminated, and if there's a way that we can get that going again. I would surely love to know why.
I am happy to follow up with our ACF colleagues, and I'll bring this to leadership attention. We'll
Thank
follow
you.
up with you. Thank you.
Thank you.
Thank you, Senator Cortez Masto. We'll begin a second round here for those that are interested. Mr. Spahn, you had mentioned the 105L leases. We all know that this is a critical tool for the tribes as they're delivering government services. We heard earlier this month from Tlingit Haida that they had, talking again about lack of tribal consultation to some of the changes made, but changes made to the guidebook, the BIA 105L Technical Assistance Guidebook. You referenced the use of 3 comparable sites in appraisals. And so, Mr. Belmard, I'm going to ask the question to you because what we're trying to do here is meet the requirements of the law, meet the requirements of the trust responsibility. When you put in place guidance that is really not only not practical, but simply not workable in a place like Alaska, again, requiring the use of 3 comparable sites in appraisals, where you simply don't have comparable facilities. I'm assuming this comes about because somebody just wasn't thinking, they weren't thinking about the challenges that we face in so many parts of the country, but most particularly up in Alaska. You are implementing before tribal consultation has occurred, and now you have situations where you've put yourself in an untenable place. How are you going to, how do you unwind this? Because if these stay in place, you have effectively stalled implementation. You certainly do nothing to reduce the backlog that you're already dealing with. Talk to me about just one simple example like this.
Thank you, Senator, for that question. If I might just expand on this idea. Before I came here, I was a tribal attorney for 35 years. I lived, and my office was in a town of about 300 people. We took advantage of the 105L program, which is a very popular program. To get 3 comps in Cass City, Oklahoma, I would agree, like Alaska, that's impossible. When we had started hearing in our hallway that there had been some decision related to this guidebook, we immediately talked to our self-governance people, asked them to reach out to find out where that actual information in the guidebook had come from and to confirm that that is actually what we're doing. And if it is what we're doing, we have asked our folks not to do that until they can spend some time with us so we can determine why the decision in this guidebook was made for these 3 comps, because it is not practical for rural Indian country.
I'm glad to hear you say it. I would just ask that you move expeditiously on this, because if this is in place and you do have folks that are looking at things and saying, well, we don't have the 3 comps, so we can't do it. Again, what you are doing is just adding to further delay in execution of these 105L leases, and that's absolutely the opposite of what we're trying to do here. Mr. Joseph, I wanted to ask you a little bit about the Alaska Tribal Health Compact and the success that we see. We're not always recognized for the bright successes that we have. Oftentimes our statistics really drive negative stories. But we have a recognized model. South Central Foundation in Alaska has a recognized model which transformed healthcare delivery through the NUCA system of care. Tanana Chiefs Conference built a system that delivers comprehensive healthcare across some of the most remote communities in our state. And I think it really speaks to the level of innovation that we've seen under that compact. I'm often asked, how can the lessons that have been learned from models like NUCA, like what TCC has done, how can these be translated and applied more broadly across IHS, across the tribal health systems nationwide? You know, you've got good examples here at the table in both Oklahoma and Alaska, where exceptional things have happened. You mentioned the success in telehealth. We were pushing that out long before anybody else did it, and we did it because of necessity. The community health aides has been a model that we have put in place that others look to and say, how did you do that? The DHAT program that we began, the dental health therapists, what the dental health aides, and what that has been able to do for oral health. We've got so many good successes, but how do we take what we've proved out in hard to find success places, like we often see in Alaska, and build these into other systems? Or is this so unique to Alaska that it's only going to work at home?
Thank you, Chairman Murkowski.
You can tell I'm really proud of some of the systems we put in place.
And I'm proud sitting here listening to your knowledge about what successes that has happened in Alaska. You know, to answer your question, to me, there's the success in the compact itself is the willingness for all the tribes to come together with the regional providers under consensus and say, this is what's going to work for us. And that through the ISDEAA, each of the tribes are able to self-govern what they need and be able to work through. Now, taking the successes and the innovations from one area to another area is really important. And it's so important that not only is it important through Indian country, it's important to rural America as well. And internationally, we're seeing more and more people wanting to come to Alaska to see, well, how are you guys doing this in providing affordable health care that is really efficient in delivering a positive health care system? And in CHAP, Community Health Aid Program, is the prime example of what can be being done nationally, as we're seeing that being rolled out now to more of the I would say lower 48 tribes. And in seeing that successes, I think that's really important. What I would hope to see, though, is more communication between Alaska compactors and the tribes that have these programs, or whatever tribe that we're trying to share information with. See less burden and control and allow more freedom for development. And so you're taking a program that was developed at home and you want to share it with other tribes, well, let them share it with them. And then work with the tribes to try to knock down the barriers that could inhibit or delay that services. And so I just believe that there's a lot of opportunity for us to learn from one another and share, and those avenues are sometimes created. We can create more to expand those type of programs that would be beneficial. So I'd like to stop there on that answer. And if I could expand a little bit, you talked a little bit about 105L, and I wanted to give you a couple prime examples. So if you give me a couple more minutes, I'd like to jump into that. You know, recently Tanana has been applying for the 105L, and what we're seeing is a couple significant differences between health services, our IHS and BIA, and basically the timeliness that it takes to get it done. We're looking at 3 or 4 months to work through IHS on our 105L agreements, and it can take up to, right now we're being told, up to 13 months for BIA. So there's a significant time difference in what's happening. At the end of the day, it's all going to go back, but to the date of your application. But that's still a significant delay when we're looking at 105L being an important component to for the tribes. Secondly, when you're talking about what it takes to get comps and what it may, when you're looking at having to maybe multiply that by 3 or, times 3 to get 3 comps, the cost to just get 1 comp is really significant. And it took us months to get through that. And it depends on the number of facilities you have to have comped, and each one of those come at an additional cost. And so if you're having to look at, in Alaska, how to bring 3 to the table so that you can work through your 105 agreement, that's going to be at a very high cost, and in Alaska, kind of really hard to do, because we're trying to find people to go out to our communities to do these evaluations and assessments. So with that being said, I think that's important. The last thing I'd like to say on top of this, I've worked with a lot of good people on both the IHS and BIA side, and they all mean really good. But you also talked about what the shortage of staff have, and we've seen significant changes in Alaska in the way that is being delivered. So I just wanted to throw that out, and anything that creates more work for others, delay any application that we're trying to get through. And I'd like to talk more about that later. Thank you for this time.
No, and I appreciate you filling in some of those details. It's time, it's money, and it's those to process it. Senator Schatz.
Mr. Spahn, in your testimony, you referred to misinformation to the tribes about the 638 process, sort of indicating that there's been some active discouragement of people trying to pursue 638 arrangements. Can you tell me what you mean by that?
Yes, Vice Chairman, thank you for the question. We have seen some concerning dialogue from IHS employees with a couple of tribes that are looking to move into a self-governance agreement, where we see IHS employees directly sort of lobbying tribal leadership, trying to discourage them away from entering into a self-governance agreement. They have shared information within their community saying that if the tribe takes it over, that members that are not that specific tribe are not going to be eligible for services anymore, which is a complete false information. They've kind of gone out of their way to derail the tribal leadership's efforts. We've also seen situations at BIA where a tribe was looking to take over new functions under its agreement, and whenever they asked the BIA for the amount of tribal shares, the amount of funding for these activities, BIA came back and said that this is an inherently federal functions, to the extent that the amount that they would get was negative funding if they wanted to enter into this agreement.
I don't want to get any tribe or any person in trouble, but could you please provide those to the committee?
Is it okay if I ask?
Yes.
Position of the tribe? Yes.
Absolutely.
Okay.
Mr. Belmart, I guess I'm maybe not familiar enough with the sort of operation of these agreements. And by the way, I shouldn't be. It should just work, right? But here we are. So there's a new field that requires a justification, and then it gets kicked to Treasury for one last layer of review. Am I right so far?
That was a situation, but we believe we are solving that, so justifications won't be required once we enter into our agreement with Treasury on the ASAP payments.
Once you enter into an agreement with Treasury, why do you need an agreement with Treasury on this matter?
The payments are through the ASAP system.
I mean, I get that they sit on the money. So is that the only reason? Because it doesn't seem to be justified. I don't mean justified. It doesn't seem to be based in the federal law that Treasury gets some final layer of review. Does it?
Senator, some of the questions you're asking me are the same questions we were asking when we were made aware of how those payments were being held up. And that's why we undertook discussions to figure out a way to work with the system so those justifications would not be necessary, which is what we believe we've worked out with the idea of all the recipients. There would be a list of recipients that would go to Treasury. Once that is all worked out, then there would no longer be justifications necessary.
But do you have to get a justification approved by Treasury and then you're good, or are justifications no longer necessary?
Once my understanding, Senator, is that once there's the recipient list that these tribes are the recipients of these type of payments, then no justification will be necessary.
In order to get on the recipient list, in other words, sort of like a pre-cleared list, how is that provided? Does Treasury still have to clear who's on the list?
That's the devil in the details that we're working through.
I mean, but that's kind of everything, isn't it? Because if Treasury still gets to say whether you're, green, yellow, or red, then we're back to violating the law, but maybe even more to the point, just slowing things down to the point where they don't function, right?
Senator, your point is well taken. The purpose of self-governance is to make this easier for tribes to have their own control over these things. So yes, it is a bit of a conundrum.
But you're satisfied, confident that this is going to get resolved? Is it resolved? Where are we?
I'm confident it will be resolved.
And what kind of time frame are you looking at? Days, weeks, months?
When we found out about this, we started working on it immediately. As we were preparing for this particular hearing, when it came up again, we redoubled our efforts and our inquiries to find out when we could actually get the proper documentation in place.
So I know you've been working on this, and it sounds like you've accelerated it. My question is, how long from now do we anticipate this being resolved? Because this is not some normal bureaucratic tangle. This is money for the delivery of services that are sort of life-saving, and it seems to me that, it shouldn't be the urgency shouldn't be the hearing, right? The urgency should be, there are a bunch of people, first of all, the statute, and second of all, the people with whom we have these trust and treaty obligations. I know you know that, but I'm still trying to figure out, you think this gets resolved by the end of the month? You think this gets resolved by the end of the year? Tomorrow? When?
I can't speculate on when these matters that take different human beings to be involved in, I certainly can't speculate on when that's going to happen.
Thank you.
So, Mr. Belmar, just to follow on to that, are you saying that there is nothing more that you are required to provide to Treasury, that this is all in Treasury's hands now in terms of the timing on all of this?
I couldn't answer that for certain, Senator, because I don't know what else might be required from our shop to Treasury.
Well, I guess what I'm trying to figure out is this is an oversight hearing on the effectiveness of a law that's been in place now for 50 years. We've got great successes. We've heard about some of them, but I think we have also heard that there are some things that need to be addressed, and that is part of what we get to do up here. And sometimes when we're talking about what that means, it means calling up the Secretary of Interior or calling up the Secretary of Treasury and saying, we've got a situation here where fulfillment of commitments cannot happen because we've got this new process. You all think that you found a way to help expedite it, and that's great. But to Senator Schatz's point, I don't think it would be acceptable to be sitting here at the end of the year and still wondering if we're going to hear anything from Treasury on this. So I would ask that you come back to our teams within like the next couple days here and let us know what more needs to be done within your department there, because I think that this is a matter that ought not be so difficult. And at a time when we're dealing with a lot of difficult political things, I'd like to get the easier ones ironed out as quickly as we can. So if you can help us with that, I'd appreciate it.
We will certainly do that.
Thank you for that. I think we've had some good comments here today. I was really looking forward to this hearing because I think it's so important in today's world where we recognize when we have put in place good things. And I think the Indian Self-Determination Act is one of those good things that really did lead to a level of empowerment and self-determination that really we continue to see the benefits of that with every single day, and with anything. Nothing is perfect, and particularly when you're having to deal with government and bureaucracies. We've got our own tribal politics that folks recognize as well. But I think we have seen how important it is for the tribes to have the discretion to design and build these programs as they felt would work. And we've certainly seen that play out in Alaska in so many ways. And it's not only about the programs, it's then what the young people see when they look to, we're doing this ourselves. This is our program, this is our people, this truly is about self-determination. So I want us to go forward from this hearing thinking about what more we can do to build upon the successes, to break down those impediments and barriers and just things that come up that may not kill a program, but when people get discouraged because they think things are just too hard or the costs have been added too much, so it just doesn't make sense anymore, they kind of give up. And that's exactly the wrong way to go when we're talking about self-determination. So we want to build on the successes. We want to get the obstacles out of the way because we all need to be pulling together to see the benefits. So with that, we've all got a little homework to do from here, but thank you all for being here this afternoon, for the testimony that you have provided. We'll probably keep the record open, I think, a little bit, 2 weeks, I guess. 2 weeks, the record is open for additional questions, comments that people may have, but we will be following up on this oversight as we have with so many of our other hearings before us. So with that, the committee stands adjourned.